Anterior surgical approach to the cervical spine. Understand the anterior surgical approach to the cervical spine, including anatomical landmarks, key structure involved, and procedure steps. The landmark the incision is made anteriorly at the level of the trachea, C4, C6. Structures visualized include trachea, thyroid gland, esophagus, recurrent laryngeal nerve, sternocleidomastoid, and carotid sheath. Patient is positioned supine with neck extended, transverse incision made at C4C. Subcutaneous tissue and platysma are dissected. Carotid sheath contained carotid artery, jugular vein, vagus nerve retracted laterally. Trachea and thyroid are retracted medially to expose the cervical spine. Prevertebral fascia open to access intervertebral disc or vertebral bodies. Avoid damage to the recurrent laryngeal nerve. Maintain homeostasis around vascular structure. Use anatomical landmark for safe dissection. At which vertebral level is the incision typically made in the anterior cervical spine? Approach C1, T3, C4, C6, C6, C7, C1, C6. The answer is C3 to C4 to C6. Which gland is retracted to visualize the cervical spine? Parotid, pineal, thyroid, adrenal. The answer is thyroid. What structure lies within the carotid sheath? Esophagus, recurrent laryngeal nerve, internal jugular vein, trachea. Internal jugular vein. True or false? The recurrent laryngeal nerve lies within the carotid sheath. False. The trachea is retracted laterally to access the spine. False. Patient 54 years old male, history progressive arm weakness and numbness, diagnosed with cervical disc herniation at C5, C6. MRI shows cord compression, procedure anterior cervical discectomy and diffusion planned. Intraoperative detail, transverse incision is made at the C5 level. After careful dissection, a retraction of the thyroid and the carotid sheath, cervical spine is accessed. Discectomy is performed and the graft is inserted. What key structure must be identified and protected during this approach? What potential complication may arise from improper handling of the recurrent laryngeal nerve? Why is thyroid gland retracted medially instead of laterally?